wildfire through adolescents and college students, people that are confined in dorm rooms and things.
We're following an active mumps warning here in the Wabash Valley. That's why we begin this evening with Health Watch 10. It's a case we started following earlier today.
Our News 10 team was out getting you the most accurate, reliable information to help keep you and your family safe. News 10's Jacqueline Beavis explains where these mumps cases may have originated and how it could spread. Meanwhile, News 10's Brent Frazier has details on how you can protect yourself from this mysterious illness. But first, in the last week or so, the Vigo County Health Department got involved after word that a mumps case started spreading, literally.
Since then, the health department confirmed 1 case and 6 probable cases. News 10's Jacqueline Beavis joins us live in the studio. Jacqueline, you've talked with health officials and Rose-Hulman Institute of Technology, where the victim is a student. What do we know now?
Mike, Patrice, we know that a week plus worth of research links the viral infection back to the University of Dayton. But tonight, most importantly, we know the virus found at least 1 victim in Vigo County, a student at Rose-Hulman, and then 6 other likely cases. That has lots of students, parents, and community members concerned about who could be next.
We had individuals that were presenting with symptoms of mumps, and we began to go out and investigate.
That's how it started. The investigation came straight here to Rose-Hulman Institute of Technology. That's where person A, the first local victim, is a student.
The blood test came back that it was a confirmed case of mumps.
Multiple cases after that one with similar symptoms. That's where the 6 likely cases come in. And that investigation, it traced steps through campus, quite literally.
Anyone else that was epi-linked or linked to that person that presented the same kind of symptoms, they're considered a case of mumps also. In epidemiology, you look at who are the immediate contacts to that individual, and then you begin to ring out farther if you have more cases develop within that first initial ring.
We confirmed that most of the victims did have the proper immunizations. I also talked to a Rose-Hulman official this afternoon. The school confirmed they do require those immunization records for all of their students. She also told me they're working closely with the health department, as are other schools and colleges locally. That's why we want to share now what you need to know to keep yourself and your family safe. We continue tonight's team coverage. News 10's Brent Frazier talked with a local healthcare provider. Brent, as I understand it, they're already working with other schools to keep everyone on alert.
Indeed, Jacqueline, including Vigo County schools, to see who might have slipped through the cracks when it comes to vaccines. We hear from Vigo County's health commissioner now to learn how you get the mumps, how to prevent it, and how it gets treated. Dr. Darren Brucken says that swollen face is the telltale sign.
It's normally what brings people to the doctor's office.
We went to the doctor for insight into the virus that dates back to the 1870s, that had its heyday in America in the mid-1950s, an illness that rarely makes the news, according to the CDC's website.
We don't expect for this to be a large outbreak by any stretch, but we're trying to put forth measures to keep this on wraps, basically. So,
containing it, Dr. Brucken says, is the only form of treatment, which is why the Vigo County Health Department is campaigning hard to reach any college student at ISU, St. Mary's, or Rose-Hulman who might have had contact with this infected student, reportedly a male.
We're trying to reach out to those students to make sure that they've been vaccinated appropriately, meaning having had 2 MMR vaccines. And then if someone is symptomatic, we're trying to put them under wraps as far as contagiousness. So we're quarantining them basically for a 5-day period once we have glandular swelling.
The doctor says mumps often resembles flu-like symptoms with body aches and pains, some fever, and a headache. He says greater damage to the body is rare.
It can cause encephalitis, which is an inflammation of the brain. It can cause death in certain cases, but it's very, very rare. Most people have a self-limited illness. They get headache, fever, malaise, they get swollen glands, and then within 10 to 14 days or so, they're back to normal.
Dr. Brucken mentioned 2 vaccines. One we get when we're 1 year old, the other about age 4 to 6, just before kindergarten. But even if you've been vaccinated, you can still get the mumps. Good news is it's like the chicken pox. Once you've had it, you won't get it a second time. Mike, Patrice?
Good information. Thank you, Brent.